to systemic hypertension, which you probably know as high blood pressure. And just to give you a sense of the scale we're talking about, our source material points to Egypt as an example. A staggering 27% of the population there is living with systemic hypertension. Think about that. That's more than 1 in every 4 people. This is not some rare disease. It's an incredibly common health issue. But you know what's really scary? Only about 37% of those people even know they have it. And the reason is as simple as it is dangerous. It's usually asymptomatic. You can feel totally fine, absolutely normal, while your body is under this immense strain. And that is exactly how it earned its ominous nickname, the silent killer. So let's really unpack what this silent killer actually is. We're going to see how this quiet, sneaky condition becomes a huge risk factor for 2 of the biggest health threats out there, heart disease and stroke. Okay, so what are we really talking about? At its core, hypertension is simply a persistent, ongoing elevation of your arterial blood pressure. The best way to picture it is to think of your arteries like a garden hose. The systolic pressure, that's the top number, is the peak pressure when your heart pumps. It's like turning the faucet on full blast. Then the diastolic, the bottom number, is the pressure when your heart is resting between beats. That's the constant pressure just sitting in the hose. When either one or both of those numbers stay too high for too long, that's hypertension. So whenever you get that cuff wrapped around your arm, those 2 numbers it spits out are the very first clues we have in uncovering this silent condition. Understanding what they actually mean is the key to knowing your risk. And this table here, based on official guidelines, breaks it all down for us. Anything under 120/80, you're in the normal range. Great. But from 120 to 129, even if the bottom number is low, that's considered elevated. It's like a warning light on your dashboard. Once you hit 130/80, you're officially in stage 1 hypertension, and the risk just keeps climbing from there. Doctors use these exact categories to figure out how serious it is and what to do next. Now, here's a question I bet a lot of you have wondered about. You go for a checkup. You're maybe a little nervous, and boom, the reading comes back high. So you think, wait a minute, is it possible it's only high right here, right now? The answer is a resounding yes. It's a real phenomenon called white coat hypertension, and it affects a huge number of people, somewhere between 20 and 30% of patients. It's basically just your body's stress response to being in a clinic. And that's exactly why a single high reading isn't enough to diagnose someone. It's why doctors will often ask you to monitor it outside the office to see what your blood pressure is really doing in your day-to-day life. Okay, so we get what hypertension is and how we measure it. But the next big question is, where does it even come from? Well, it turns out there are 2 main types, and they have very, very different origins. And wow, just look at this chart. About 95% of all cases are what we call primary or essential hypertension. A tiny 5% slice is secondary. That massive difference tells you something really important. For the vast majority of people, there isn't one single obvious bad guy to point to. And that gets to the absolute core difference between the 2. Primary hypertension is the condition. It just kind of develops over time without a single clear trigger. Secondary hypertension, on the other hand, is a symptom. It's high blood pressure that is being caused by some other medical issue. For that big 95% primary hypertension, you got to think of it more like a perfect storm of contributing factors. Your genetics can play a big role for sure, but so do lifestyle things like eating too much salt or dealing with chronic stress. And then there's the complex biology stuff, like your blood vessels getting stiffer over time or glitches in the hormone systems that regulate all the fluids in your body. Now, with secondary hypertension, the cause and effect is way more direct. We're talking about things like chronic kidney disease, certain kinds of tumors, even a birth defect in the main artery of the heart, or severe sleep apnea. This is why if someone's blood pressure suddenly spikes or it's really hard to treat, doctors will immediately go on a hunt for one of these underlying culprits. So we know what it is. We know the 2 main types. But what actually happens when this silent killer is left to do its thing year after year? Let's take a look at what that constant, relentless pressure does to your body. The damage is targeted and it's severe. In your brain, that high pressure weakens blood vessels, which can lead to strokes or what are known as TIAs, sometimes called mini strokes. And your heart, well, it's a muscle and it has to work way, way harder to pump against all that pressure. Over time, it gets thicker and stiffer. You might think a bigger heart muscle sounds strong, but it's actually less efficient, and that can eventually lead to arrhythmias and even heart failure. And it doesn't stop there. Your kidneys are this incredibly delicate filtering system, and that constant high pressure just wears them down, sometimes leading to total renal failure. Your aorta, the biggest artery coming right out of your heart, is also under constant strain. This can lead to a life-threatening tear called an aortic dissection, or contribute to blockages in the arteries in your legs and feet. And if you want a really clear visual picture of this damage, just look at what happens inside the eye. There's a condition called hypertensive retinopathy, and it progresses in these really clear stages. It starts with the tiny arteries just thickening up. Then they start to spasm. Then you get actual bleeding and fluid leaking. And in the worst cases, the optic nerve itself starts to swell, which can cause vision loss. The eye is literally a window into the damage that's happening all over the body.
Okay, after hearing about all that potential damage, it's really easy to feel worried. But here is the most important part of this whole discussion, the good news. Hypertension is a highly, highly manageable condition. So let's pivot from the problem to the powerful and effective solutions.
The very first step in taking control is having a clear target. And the goal for pretty much all adults is to get that blood pressure back down below 130/80. It's a simple, measurable objective that everyone can work towards. So how do we actually get to that target? Well, the approach is basically a two-pronged attack. It's a combination of lifestyle changes, what doctors call the non-pharmacological stuff, and medication. And they work best when you use them together. And you really can't overstate the power of these lifestyle changes. We're talking about actionable steps that you can take. Cutting back on salts, getting regular exercise to make your heart stronger, quitting smoking, all of these things can have a massive impact on your numbers. It just goes to show how much personal control you really have here. Now, when lifestyle changes aren't quite enough to hit that goal, doctors have this incredible toolkit of medications. There are several different types, and they all work in different ways. Some help your body get rid of excess salt and water, others work to relax and widen your blood vessels, and others block nerve signals that raise blood pressure. There are always new and better options being developed too. So we've seen that hypertension is common, it's silent, and it's dangerous. But we've also seen that it is absolutely manageable. It's called a vital sign for a reason. It is a fundamental indicator of your overall health. So the question I want to leave you with is a really simple one. Do you know your numbers?